and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. We're live. This is Dr. Lederman on WOR. We're talking about patients and how to learn from other patients and medical news. Next patient I'd like to talk about is a 70-year-old woman who came. She has a lung cancer, was treated successfully. Let's get this call. Excuse me. Good morning. You're on the radio. This is Dr. Lederman.
Yes, sir. The question, sir, is I was recently diagnosed with small cell lymphoma. I'm a man in my 80s. Just curious whether I'm down at a major hospital, cancer hospital in New York City. I just wondered if you had any thoughts on this disease.
Well, we treat a lot of lymphomas, and the reason we treat a lot is that it's very successfully treated. Our success rate in treating lymphomas is overwhelming. 9 out of 10 patients we treat are successfully treated. So I'd be happy to meet with you and review your case and go over the details. We also have a booklet which we can send you if you call us during the work week at that 212-CHOICES number.
I thank you, sir, for your time.
Okay.
And I realize this disease is not amenable to surgery.
Well, who wants surgery? Why would you want surgery? I mean, that's the fact that you don't have surgery is a good thing. If you can have something that's non-surgical, like radiosurgery, it's a lot better. So often surgeons spread cancer when they cut. Often there's side effects. There's anesthesia. There's cutting. There's bleeding. There's convalescence. If you can have those results, better results, without invasion, that's better.
Thank you, sir, for your time.
All right. I hope to meet with you. And if you have questions anytime, if you want to speak privately or meet, just call the same number, 212-CHOICES.
Yes, sir. Thank you for your kindness.
God bless you. Bye-bye. Good luck.
Bye-bye.
Okay, so thank you, gentlemen, for that call about lymphoma. Yes, we treat lymphomas and have quite a successful track record. Anyway, we were talking about a 70-year-old woman treated with lung cancer in the past. She now has a bladder cancer. She had symptoms. She had bladder symptoms. She also has high blood pressure. She has diabetes. She has heart disease. She is obese. Unfortunately, she's obese. She had local symptoms. She had infections of the bladder, supposedly. She had abnormal cytology, which means doctors looked and they saw that the cells in the urine were cancerous. She had cystoscopy, which is when the urologist looked inside the bladder and found the cancer, which was a large cancer. She went to several cancer hospitals close to us and not so close to us. One didn't take her insurance. One then decided to treat her, or decided to evaluate her, let's say. She came in, and the doctor said she should go home with no treatment. So this is at the very big cancer hospital, and she was pretty disappointed that they didn't offer any solution just because she was overweight. They sent her home. She's 260 pounds. She's 5'1". She had no PET scan. She came to us on Thursday. In 3 hours, we got her history. We examined her. We did the stereotactic body treatment planning process, and we got a PET scan. We got everything that wasn't done in several months elsewhere. We got it all done in one half of an afternoon. So what's the news? Well, the scan shows the cancer is still in the bladder. It's in a couple lymph nodes, but it has not spread distantly. It's not in the lungs or bones or liver or kidney or spleen. So it's bladder cancer with lymph node involvement. We did the planning. She wants just a few treatments. We're going to treat her, and the goal of treatment is to try to shrink down the cancer, hopefully make her better and live longer, hopefully get her into remission, only with radiosurgery. So we can treat patients even if they're short or fat or tall or skinny or have lung disease. Radiosurgery is non-invasive. And like the caller just said, oh, I can't have surgery. Yeah, thank God you can't have surgery. Thank God you can have a replacement, and thank God that this technology exists, that we can hit the cancer, not hurt healthy tissues in general, and have high control rates where we aim our treatment. So thank God no surgery. Thank God no cutting, no bleeding. Thank God for radiosurgery. We brought this technology to America. We brought this technology to the Western Hemisphere. We've treated about 20,000 patients. We brought this technology to New York. We have patients coming from all over the world, patients from China and Italy and Israel and England, France, Spain, Africa. So patients come because they want a better chance. Some want a chance. Some want a different chance. Some have already had surgery, chemo, and radiation, and it didn't work or wasn't tolerated. So, wow. Here's another case I saw this week. So, yeah, it was a busy week. Saw a lot of interesting patients. Had time for everybody. Answer my phone calls. See the patients. This woman came in. She's a 67-year-old woman, a Hispanic woman. She was born in Ecuador. She was referred by her surgeon for breast cancer. She had a left breast cancer. She chose to have lumpectomy and treatment. And when you have an invasive cancer and you have lumpectomy, you should have radiation. Multiple studies have shown you'll actually have better results with lumpectomy, which is to remove the lump of cancer followed by radiation, than just lumpectomy alone, or even mastectomy. Some people falsely believe mastectomy gives better results. It does not. Multiple studies have shown that. Losing your breast doesn't mean anything other than you've lost your breast. And if you think you're going to get a reconstructed breast that looks anything like God gave you, you should look at a reconstructed breast before you go down that route. So this woman came, and I called her chemo doctor. She had seen a chemo doctor earlier in the day, and I asked her about the case, and I need to get the records. And she said, well, she's got a 5-centimeter mass. She's got a big tumor, but no lymph node involvement, which is strange. I mean, she said she had a 5-centimeter tumor in the left breast removed. I looked at the mammograms, and the mammogram showed a small tumor. So, wow, there's discrepancy. So when there's discrepancy, usually it means that something's not right. Because usually there's not discrepancy. Usually there's logic. There's logic. If you take the time and investigate, usually logic wins. Almost always logic wins. So this woman was so worried. She's going to get chemo for a 5-centimeter tumor, and obviously she needed radiation because she was saving her breast, lumpectomy and radiation. And I got the pathology, and I reviewed the pathology, and guess what? The skin taken off of the breast was 5 centimeters. The lump was 1.7 centimeters, 2/3 smaller. So in fact, instead of having a T3 breast cancer, she has a T1 breast cancer and lymph node negative. So she's T1, that's the stage in the breast because it's less than 2 centimeters, N0 node negative, M0 metastasis negative. So she's about the earliest stage. So instead of being a T3 getting chemo, she's a T1. This woman who doesn't speak English is so happy. I said, do you want me to treat you or someone else to treat you? That's after we spent this time and I examined her, and she understood that she was downstage from a T3 to a T1. And I called the chemo doctor back, and I said, she was really just 1.7. The 5 centimeters was the size of the skin removed. And she said, oh, I'm so sorry. I just didn't have time to read everything. I said, it's okay. I just wanted you to know that this is a small tumor, and she's going to do great. So this woman, T1, N0, 1.7 centimeter invasive cancer, lymph node negative, no metastasis. She's going to do great. And the point of this is, as my grandfather said 50 years ago to his doctor, sit down, close the door, and let's spend some time together. And when you do that and get all the documents and give copies of the documents to the patient and their family, everyone learns, and everyone gets better treatment, and everyone participates. So the patient shouldn't be a victim in the medical process. The patient is the king or queen. And I always tell the patient, you are the president of the United States of your body, and we're just your advisor. So you can get an idea from this case and from other cases we're discussing, our philosophy in how we treat and take care of patients,